And good evening, everyone. And welcome to this episode of the Ask Dr. MJ Facebook and Instagram live broadcast. We are here in the studios of Atlanta West Primary Care, and we're here to answer your healthcare questions. It's always a plum pleasing pleasure to have you join me this evening because I know you have options, but our reasoning is to provide you with important medical information that you can take and share with your families and your communities. So let's get together right now and do what we do best. It's time. Okay. So thank you very much, Holly. We appreciate you for putting everything together. Thank everyone who's on right now for tuning in and participating in this live broadcast. We're going to start off talking about the current concerns that everyone has about the coronavirus, the COVID. It's back. We're seeing multiple cases. I've had family members that have been infected. As a matter of fact, I have to go, when I finish this broadcast, I have to go check on a few people and do some testing to see how they are doing. There are currently 3 variants that are out there now, and these variants are 2 are minimal. They're just slight variations of the Omicron that was out there, but there's one that has multiple mutations that we are concerned about. It's now a virus of interest, a mutation of interest as deemed by the World Health Organization, and the CDC is monitoring this. So your current vaccine status, hopefully you've gotten at least 2 shots, and over a significant number of people in the population have actually had at least 1 episode of COVID. So the CDC estimates that 97% of the U.S. population has immunity to the coronavirus. 97%. Doesn't mean you won't get it. Immunity means that if you do get it, it should be mild and it should be self-limiting. Means you shouldn't have a bad case. But people are testing positive. It's out there. There is no magic bullet. We do have the diagnostic test. We do have the treatments that are available now. And so if you have respiratory tract symptoms, use your home COVID test. If you don't have any, go stock up on them now before they become difficult to find. Insurance companies are still paying for those tests, and they're not expensive. You probably still have some from when they were given out free by the United States government earlier. If you don't, and even though they may be past their date, they're still good. And if you test and you test positive, that is a positive test. You don't have to keep retesting yourself. One of my family members tested. She had a whole stack of them. All were positive. I said you could have stopped after the first positive because there are not going to be false positives. There may be false negatives based on the age of the test, based on the test taking technique. In other words, if you don't get that swab in the area that it needs to go to, and again, that's deep down in the nose, not just wiping the outside of your nose, then you might get a false negative. But if you get a positive, you have a positive. So we are now the Atlanta University Center here in Atlanta. That's the consortium of schools. That's Morehouse College, Spelman College, Clark Atlanta University, the Interdenominational Theological Center, and the Morehouse School of Medicine. They have implemented COVID protocols once again based on a increased number of cases on those campuses. And so it's important that we do the same. So we're recommending now that you start utilizing masks again when you're in environments with large numbers of people, that you also in addition to using masks, you social distance. And, again, use common sense as far as that goes. If you are sick or if you're around people that appear to be ill, then limit that contact when doing so. Okay, Hylick, let's get this show on the road. Let's do our roll call and see who's already here and participating. Okay, Crafty Cupboard, Chantel from Macon, Georgia. Chantel, thank you so much for being here this evening. Okay, Deborah Mathis, good afternoon. Deborah, thank you for joining us as well. We appreciate you. Mimi Witcher. Good. Mimi, thank you so much for joining. We appreciate you. I hope you're down in Tampa. Sean Big Time Green, my main man from Monroe. He was one of the first male participants that we have in this show. And Sean has hopefully been spreading the good news amongst his male friends whenever there's a male gathering at the barbershops and any other place that men get together. Share this healthcare information, Sean. You are my advocate. Sherry Warren. Hello, Sherry. How are you? Thank you for joining us this evening. Okay, Rod Lewis. Good afternoon, Rod. Thank you for being here this evening as well. I hope you get some good information. Sherry Warren, Canada is in the house. All right, Sherry, we appreciate that. We have Canada, we have Africa, we have California. That's good. Cindy Hill from Fort Worth, Texas. Boy, it is hot as Hades in Texas. Rosemary, good evening. And everyone, thank you so much for joining, Rosemary. We appreciate you. William Gorham. Hello, William. That's a hell of a hat you got on there, sir. Chris Goodjoin, good evening from South Kakalaki. South Carolina is in the house. Tammy Harrison. Hello, Tammy. Thank you for joining us. We really appreciate you. Hey, Regina, Dr. Regina Fletcher. Hello from Atlanta, one of my favorite Facebook friends. Anita Suber, good evening. My day was great, and now it is even better because we are with you here. Jacqueline, keep it moving, Duncan, from Dallas, Texas. Dallas, where it is. Be careful out there. Make sure you hydrate. Greg Austin, hello from the 919 Durham, North Carolina. All right, Greg. Hey, Winnie King from Terrell, Texas. Hi, Winnie. How are you? Good to hear from you once again. Okay. Hey, once again, Dr. Regina Robinson Fletcher. Hello from Atlanta. Great picture when you upgraded there. Tracy Conyers from Beaumont, Texas. Tracy, thank you so much. We got a lot of Texans that are listening and participating. Stevie Griggs. Hey, Stevie, another man in the house. Hello, and thank you for participating. Deborah Method, it is set on hell hot. It is. So be careful. It is not just hot now. It is dangerously hot now. So we really have to be serious. Derek Griffin. Hi, Derek from Chicago. Hey, boy. There we go. Frat bro, thank you so much for joining us. We appreciate you. Deanna Pope. Hello, Deanna. Love you. And thank you for participating as well. We appreciate you. Cynthia Benson from North Kakalaki. Thank you, Cynthia. We appreciate you. All right. Andy Barron from Daytona Beach, Florida. Now we south where we want to be. Boy, I wish I was on the beach right now, Andy. Tranisha Acree, good evening from D-Land, Florida. I love D-Land. That's a nice, quiet part of Florida that everybody hasn't discovered. Thomasine Morris from Birmingham, Beham, Alabama. Thank you, Thomasine. We appreciate you as well. Thank you, Holly, for doing the roll call. We appreciate it. We'll come back and do another one about midway through the show. Thank you once again, everybody, for participating this evening because, again, we gave our COVID update, and it's very important. But let's talk about this weather, this heat. We have had more deaths from heat-related weather illnesses than hurricanes, tornadoes, floods, any other weather phenomenon that we have had in the last 6 months. We have had more deaths related to the heat. And so you have to be very careful out there. You have to be conscientious about your parents and your grandparents and anyone who's still living on this earth and doesn't use or doesn't like air conditioning. We have to make sure that we check on those individuals, make sure they have a good water source, make sure that they are able to cool down. That may be sitting in a cool tub of water. If it gets to that extreme, fans are just moving around hot air now. So this is not just uncomfortable or unpleasant. It is dangerous. The temperatures that we're having now are dangerous. I took a bundle of clothes to the dry cleaner yesterday morning. Now, this is 7:30 in the morning. I stepped in there. It was already sweltering. The young lady that was behind the counter, I said, you need to cut on the air conditioner. I said, this is like an oven. It's dangerously hot. She was older. She was frail. And I could tell this heat was really getting to her, so to speak. So I said, look, you need to just close the door and close. I said, this is just not safe for you in here. And she was at the time by herself. And so just not something that I recommend. So please, just common sense things that when you're out there, you may notice that when you're driving your car in this heat, as that sun comes through your windshield, it is like a greenhouse. So even if your air conditioner is blowing full blast, you still are getting too much heat. And if your car overheats and you have to cut the engine off, that means no AC. And if you're stuck, on that highway or on the street where that concrete absorbs the heat and then reflects it like an oven, it can go from bad to worse very, very quickly. So be safe out there. Keep water, preferably the liquid of choice, in your vehicles. So little portable cooling fans if you need them, if you get stopped for any reason. If your vehicle stalls in this heat, don't wait. Don't sit out there. Call somebody to come pick you up immediately. Get out of that situation or circumstance. Don't sit there hours waiting for a tow truck that may not even get there. Call a friend, a family member, somebody to come rescue you. That is literally a 911 situation. And so in Atlanta, we have people that monitor the highway system. That's a 511 call, and they will come and assist you and get you out of that circumstance. So let's get to your questions. That's what's important. We want to hear what the people want to talk about tonight. So let's start running them. Thank you. Tasha Mooney Prudhomme. This morning you mentioned medication works better than metformin for diabetes. I'm currently on Mounjaro. Okay, Mounjaro is a GLP-1 inhibitor and one of the best medications that's out there. I'm surprised that you have an allergic reaction, but if it's 1 out of 1 million people and it happens to you, it's 100%. But that's the other class of drug that I neglected to mention. I mentioned 2 when I introduced that comment. But the Mounjaro, Ozempic, Wegovy are medications that are called GLP-1 inhibitors. They are injectables. And so the person that asked the question said anything but injections. They didn't want needles. So that's why we talked about the SGLT2 inhibitors. Those medications are Jardiance and Farxiga. There's another one called Steglatro. And so these are out there. You ask your physician or your provider to offer those to you. You should not have any problems with them. But again, SG, that's S as in Sam, G as in Gamma, L, Lima, T, Taco, as in SGLT2 inhibitors. And what those medications do, the way that they work is they make you urinate out excess sugar so that your blood sugar decreases, and you also urinate out the calories associated with that sugar, so you lose weight spontaneously. It just happens when you're on that class of medication. Mounjaro and Ozempic work by doing 2 things. They slow down gastric emptying, which means your stomach holds food longer and makes you feel full for a longer period of time, and it also decreases your appetite. So those 2 mechanisms are very, very effective in making you lose weight, because as you see, everybody's losing weight that's taking that class of drug. So good luck with that, Tasha. Make sure that you talk to your provider about it. I'm sorry that you had an allergic reaction to the Mounjaro, but I hope when you say allergic reaction, if you're having abdominal discomfort, nausea, or that's one of the things that happens with that. And some people, diarrhea and or constipation, it can alternate between. But if you overeat while taking that medicine, you're going to have nausea, and a lot of people may interpret that as an allergic reaction. But if you broke out in a rash, or your mouth or your lips swole, that's a real allergic reaction. So you don't need to take that anymore if that is indeed the case. So follow up with your primary care or your endocrinologist. Tell them that you're having problems with the Mounjaro. Boy, I tell you, you have it. Obviously, your insurance company is probably paying for it, because the cost of that medication is anywhere from $1,600 to $800 per month. That's $1,600, $1,800 per month. But it works. It works. Okay, great question. Alasta Taylor, my wife and I are planning on having a child. I have a low sperm count and my ejaculation is not that strong. What can you recommend to improve this, and how long will it take for results? Alasta, one of the things I recommend is a product like my Lipo T. That increases your libido, increases your sperm count, and increases your sexual desire and the quality of your erections. But you don't have to have a high sperm count. All it takes is 1. And so there are millions of sperm in each ejaculate. Even if yours is half of what most people's are, then you still are capable of fathering a child. If the count is too low, they can actually harvest your sperm and literally directly inject it into the cervix of the uterus, which is where the egg is. Well, the sperm has to swim through the uterus, come out the fallopian tube. Most eggs are fertilized outside of the uterus, and once they have been fertilized, the fallopian tube literally sucks it, kind of like an octopus, back into the uterus where it's implanted. A fertilized egg is not a pregnancy. A fertilized egg and an implanted egg that thrives and survives is a viable pregnancy. But there are even certain birth control pills, they allow an egg to be fertilized by sperm every month. So technically, you could be getting pregnant every month, but you're not having a viable pregnancy, because the birth control pill mechanism of action makes the uterus an unfavorable environment. The egg cannot implant, ergo the egg cannot survive. So when you have a menstrual cycle, the egg comes out, fertilized or not. So that is the normal action of a menstrual cycle. So when you have that, you don't have a viable pregnancy. So this is going to be, you have to plan. And the key thing is that a woman literally can only get pregnant 1 day a month. 1 day out of 28 days is the day of fertility. The sperm can live for 48 hours. So you count 2 days before that 1 day, 2 days after that 1 day. So you have a 5-day period called that's the period of fertility And before that and after that, as a matter of fact, immediately after that is the absolute infertile period. That means a woman cannot get pregnant no matter what. So if you're having sex during that period, you're only having recreational sex. It is impossible for the woman to get pregnant. Now, you say, Dr. Collier, it's only one day. How do we find it? It actually can be easily calculated using a calendar, and there's some online programs that will do that for you. It's based on monitoring the menstrual cycle of the female and counting the days that she bleeds and the days she stops. And then those programs can calculate and tell you that period of time, that 5-day period where you need to have sex nonstop, trying to conceive and doing so. And the rest of the time, you just have recreational sex. Don't get focused so much on trying to impregnate, because then it becomes work and not fun. When it is fun, pregnancy always happens. I'm sure you've had an incident like that in your life. But when it is work, sometimes the stress of the work makes it the woman's body not capable of carrying a viable pregnancy. And so the stress doesn't allow for the egg to be fertilized, or if it is fertilized, it doesn't implant. So good luck. Keep us informed and enlightened, and let us know when that pregnancy happens. Okay. Crafty cover. What do I recommend for appetite suppressant? Well, there are several things. One, intermittent fasting. Let's start off naturally. Intermittent fasting will do that. And then this eating everything you're going to eat in 1 8-hour period. By the third or fourth day, your body starts to adapt and you're just not hungry. Your appetite will be suppressed. Then the LipoDrops product. Go to the website, lipodrops.com, and it will tell you about the LipoDrops. One of its mechanism of actions is it decreases your appetite. And then it also allows your body to optimally metabolize your food so that food and the calories associated with that food are not stored and converted to fat. They're metabolized and then passed through urine and feces. So when that happens, the process takes a couple of weeks for your body to adjust to it. First, it stops and realizes that, hey, we're no longer storing fat, food as fat, don't need to do that. Then it says, okay, not only do we don't need to store food as fat, we can release some of the fat that we have stored because we're not storing fat anymore. We're in fat metabolic mode. So you're metabolizing that fat as fuel. So the whole process, once you're into it every day, you get some benefit. But by the time you've been on that product for a couple of weeks, now you're not just no longer storing fat, you're burning the fat, and that process continues throughout. Then there are prescription medications. The most common is a medication called phentermine. It works directly on the receptors in the brain, and it tells you that you're full. It makes you feel as if you're full, and so you're just not hungry. It cuts and curbs your appetite in doing so. So multiple ways to do it. The natural way with something like intermittent fasting, a supplemental way by something like the LipoDrops. Now the LipoDrops Maximum Strength Formula, which you put one dropper full under your tongue before each meal. And now we have the Lipo Nights, which has other things in it that we want to share with you, the Lipo Nights. Lipo Nights, great product you can take at night. So instead of just taking the LipoDrops with your food, you take the Lipo Nights, which has great appetite suppressants and food supplements in here that will help. It also has magnesium, which will help with things like leg cramps and help you your muscles feel better. Melatonin to help with your sleep. Just great products. If you look at the weight loss blend, the burn blend, that's what makes it different. Last time we had a question and say, was this just a reformulation of the LipoDrops Max? Totally different from that perspective. It even has vitamin D in here as well. So great way to additionally increase your fat burn, the Lipo Nights, which is available on the website right now at 25% off. So if you do the LipoDrops Max, you get the Lipo Nights, then you'd be great. The Keto Max also puts your body in a state of ketosis. It's like the Atkins or the South Beach diet without having to do the Atkins or the South Beach diet. So that the ketotic formulations make your body burn fat in a very efficient manner as well. So lots of ways to do it. Go to the website, lipodrops.com, enter your information, and it will direct you, it will tell you and make recommendations as to what it is that you need to do to lose weight the way you want to do it and what best fits into your lifestyle. I tell patients, and they ask the question, how much can I lose and how quickly can I lose it? Everybody wants to lose a lot. Everybody wants to lose it yesterday. So depending upon which supplements you get, how many different supplements you get in your weight loss regimen, and again, how you alter your food consumption, then that's going to change. Remember Dr. Collier's most important catchphrase: you do not lose weight in the gym. You lose weight in the kitchen. Okay? You go to the gym, work out, you'll get fit, but you're rarely going to lose any substantive or significant weight. As a matter of fact, most people who go to the gym end up gaining weight. One, if they convert fat to muscle, muscle weighs more. So they're going to do that. A significant and substantial workout of 1 hour's duration burns 800 calories. Okay, you have to burn 3,500 calories to lose 1 pound. So you can either burn 3,500 or you can reduce your caloric intake 3,500. That's why a lot of diet plans recommend cutting your caloric intake by 500 calories a day. That's times 7 days is 3,500. So that's why virtually every diet plan that you have heard about gives you and says you'll lose a pound a week or up to 5 pounds per month. Now, there's not a single month that has 5 weeks in it, but they just round it up. So that's reasonable, but 500 calories per day decrease in what you're doing. That could be cutting out 2 cups of sodas when you have your lunch and dinner versus just drink water instead of sodas. But there are multiple ways to do it. But the bottom line is that with those calorie restriction diets, you will lose weight. They all work. If you do what they tell you to do, exactly the way they tell you to do it, you will lose weight. The problem is, as soon as you stop doing it, you gain it all back. And so our objective is not to get weight off of you for the next wedding, the next class reunion, the next major event where you want to look good. Our objective is to get the weight off of you and keep the weight off of you. My concern is not where you are in 6 weeks. My concern is where you are in 6 months, because following the LipoDrops diet plan can get a substantial amount of weight off. You have patients that have lost 50 pounds, 100 pounds following these guidelines. And if you continue to do a maintenance program and continue to do those things you need to do so that you don't regain the weight, then you'll still be looking good in 6 months, because we are altering your metabolism, the way that your body metabolizes food and stores fat versus the way that it does now when you're gaining weight. And when you also, again, every diet plan that's out there has you restricting calories, and that's why you're losing. So the objective is to not do that. The objective is to change your body to a more healthy metabolic process that allows you to decrease your weight, become more lean, decrease your body fat, decrease your BMI, and you just feel better. You have more energy. You're able to do more things. You feel better. You look better and look younger. You have a youthful appearance. That is the way you want to lose weight. You've seen people that have lost weight by calorie restriction, and after a certain point, they not only don't look good, they look bad. They start to look sick. They start to look ill. They start to look like they have a disease or disease. And so you don't want to be skinny but not look good. You want to look healthy. You want to have tight skin. You want to be asking people, say, wow, you look amazing. You are glowing. That's what we want you to do, and that's what you're going to get with some of these products. So go to the website, lipodrops.com. You can look at the LipoDrops Maximum Strength. That's our formulation of note. We started off with a traditional LipoDrops formulation. People were taking it, losing weight. They said, well, if I take a little, if I take more, let's see if I lose more weight. And guess what? They did. So we did research and decided we were going to increase the dose. And that's why you have the maximum strength LipoDrops now. But now with the Lipo Nights, that is a combination that's going to just be absolutely amazing. It's one that I'm currently utilizing myself. I'm trying to knock off at least 5 more pounds. As you know, in Dr. Collier's weight loss journey, I'm 30 pounds down. I want to do 5 more pounds, and that way I kind of got a little leeway. So if I want to do something, a big weekend, go on a cruise or something, I have the ability to gain 4 or 5 pounds without any problems. So there we go. Great question. Next one. Okay. Gwen Sayers, how do you feel? How do you treat valley fever? My daughter lives in Arizona. About 3 weeks ago, she took a Tdap shot for work. Right as she noticed this nagging cough. I'm her mom and I'm in Houston. Okay. If she's having a reaction to the Tdap shot, and I've not heard of a cough being associated with it, but doesn't mean that it isn't, like I said, because Dr. Collier hasn't heard of it, or if it happens to you, it's 100%. So no matter what the pundits say, no matter what the recommendations are, if you did it and then something happened, then it happened to you. And so we have to be very careful at it. But when you're coughing, that's due to inflammation of the bronchial tubes and the bronchi. So the treatment can be, she may need a course of a particular antibiotic called azithromycin, commonly known as a Z-Pak. That antibiotic kills bacteria, but it has an inert anti-inflammatory capability that seems to help tremendously with the inflammation in the bronchial tubes and the lungs. So that would be good. That's going to require a prescription. Natural things that we can do. Our vitamin D product, 5,000 international units per day. That is the body's natural anti-inflammatory. Also would probably benefit from some omega-3 fish oil, which also has an anti-inflammatory capability. It works from a different mechanism. So those two things, possibly again, the antibiotic, again, a decongestant mucolytic. I recommend Mucinex, Mucinex, DM, maximum strength. That is now available over the counter. It's one large pill. You take it twice a day. That clears up sinus congestion, chest congestion, and the DM portion is for cough. So regardless of the etiology of the cough, it will help control that. So hopefully your daughter will get better. Keep us informed, Gwen. We want to know how she does. Okay, Cameron Trimble. I was recently diagnosed with leukemia. Is there anything I can do to get my white blood cell count down? Okay, so leukemia is a disorder of the white blood cells. So that's going to require some treatment, usually by an oncologist and or a hematologist. Most hematologists are dual, they hematology/oncology. So there are great treatments for various types of leukemia nowadays that are very effective. Sometimes they aren't, and if they are not, then the primary therapy would be a bone marrow transplant. So you're going to have to get a bone marrow test if you haven't already. That will determine how which your bone marrow makes your blood cells red and white to see how, what is there any pathology going on there, anything you need to do. And then again, Google new treatments for leukemia because there are several that are very effective in treating that. You're going to have to partner. This is not the time to shy away from your doctor. You and your doctor need to work together to get this under control as quickly as possible. Because if you have, alterations in your blood count, the white blood cell count, the white blood cells that are made when you have leukemia don't work as well as they should. So white blood cells are your soldiers in the fight against infection. So when you get sick, the white blood cells fight infection. Your antibodies are fired up, but your white blood cells literally go in like soldiers and eat up the bacteria, eat up the viruses, etc. That's what your white blood cells do. But leukemic white blood cells don't function as efficiently. So you're more susceptible to infection, even though you may have more white blood cells. You say, wait a minute, I have extra. So why is this a problem? I should be a super soldier because although you have a lot of them, they don't work well. So this is an issue that's going to take some continuous treatment. So Karen, we want to find out how you're doing. Keep us informed. Tune in for our Facebook Live and give us an update and let us know what your oncologist said. If you have not been seen by a hematologist, a blood specialist about this problem, then that's your next step. That diagnosis can be made by a primary care doctor, family medicine, primary care, internal medicine specialist, but the treatment and the treatment options are best implicated by a hematologist, oncologist. So great question, Cameron. We want to find out, and we will be monitoring this. Next question. Marta Mummy, can Lipodrops Max help with FUPA? I had that question twice this week, as a matter of fact. What FUPA is when you have actually lost weight and you get excess skin that can fall over and cause a pouch-like effect on your abdominal wall. Now, so Lipodrops Max can help decrease the amount of fat, decrease the amount of the pouch that you have, but it won't eradicate it because the primary component of the pouch is skin. And so under the skin, you have fat cells. The Lipodrops will help eradicate the fat and decrease the amount of fat. It won't remove it 100% because you need fat, but it can help decrease it. But it's, the thing with that FUPA, you can do some skin tightening procedures that can help with that. But oftentimes it literally becomes a surgical problem where they just take that fold of skin, cut it, and re-sew it, and tighten up the abdomen when they do so. So that is a consequence of weight loss that not one you think about, particularly if you have had a significant weight loss. But that skin problem, if the skin folds, and because you have skin on skin contact, it makes that area very susceptible to fungal or staphylococcal infections. So if that happens, that makes this a medical problem, not a cosmetic one. And so you present that to your insurance companies, and they should cover the surgical removal of that if it comes to that. But again, the LipoDrops Max will help with the FUPA, will not probably get you where you want to be with it. So it's going to be a combination of things. But the LipoDrops Max will help not just with that area where you have fat, but other areas as well. Again, the back of the arms, across the back in the bra line, the outer saddlebags in your thighs. All of those things will improve markedly because the LipoDrops Max makes you metabolize fat. And so it works where the fat is, and it works in areas that you cannot traditionally exercise the fat away. There's no exercise that will remove the fat from the back of your arms. There's no exercise that removes the fat from your back, the back fat. There's no exercise that removes the abdominal fat. We say lose the muffin top with LipoDrops. You can exercise, do 1,000 crunches per day, and you will have a six-pack underneath 6 or 8 inches of fat that you can't see. You may feel tight down there, but you have to metabolize and get rid of that fat. And that's one of the things the LipoDrops Max can do for you. Great question, Marty Mommy. Okay, Rod Lewis, enlarged prostate. Why is it so prevalent in African American men? What can be done to shrink the prostate? Rod, that might be the question of the day, my friend. The best thing you can do for prostate health is frequent ejaculation. The more often you ejaculate, the smaller the prostate will be. Understand this, the prostatic tissue is like a sponge. When you ejaculate it has two components. It has prostatic fluid, which is basically giving your sperm cells something to swim in. Your testicles create sperm cells. They need a pool to swim in. The prostatic fluid gives it that. The prostatic fluid serves two functions. It gives a safe environment for the sperm to swim in, but it also protects the sperm cells from the unfriendly environment of a woman's vagina. A woman's vagina hates sperm cells. It attacks sperm cells as if they were an infectious agent or a foreign body. So now once those sperm cells have survived the angry environment of a woman's vagina and they're safely inside a woman's uterus, then that's a safe environment. But they got to survive long enough to get there, and that's what the prostatic fluid does. Now, your prostate makes prostatic fluid 24/7. So it's like a sponge. If you are making prostatic fluid and you're not getting it out of there, and the way that it gets out of there is when you ejaculate. There's a muscular capsule around the prostate that literally wrings the prostate out. That's why, particularly when you're young, when you ejaculate, it literally skeets out. Now, we used to go across the room. Now, if you're lucky, it doesn't fall all over your feet. But it's still a skeet process because the muscles violently contract, emptying out the prostate. If you're not doing that, the prostate continues to make the fluid, so it goes from here to here to here, and it stretches. Just like you take a sponge when you first open it up, it's flat and small. You wet it, it stretches out, it never goes back to that small size. Your prostate, once it's grown and stretched out, it will never go back to that small size, but you can shrink it somewhat. Again, so primary therapy is frequent ejaculation. That's a minimum, gentlemen, a minimum of 2 times per week. Now, 2 times per day is not too much. You cannot overuse the prostate. The more you have sex, the more you ejaculate, the better. And I tell men sometimes, they say, well, my partner won't cooperate. I don't have a partner. Then you have to go Malcolm X by any means necessary, whatever it takes to get that out of there. You know what I mean? Then you perform that act so that you can ejaculate and keep your prostate small. So frequent ejaculation. There are medications. There's one called Proscar and there's one called Flomax. They work on the prostatic tissue and cause it to shrink. They are very, very effective. The problem with a large prostate is this. Your normal prostate, when you say in your 20s and your teens, is about the size of a chestnut. As you age, and again, this prostatic fluid is continuously being made from the time you're about 12 years old, the prostate grows and stretches. So by the time you're 40, it grows basically every decade, it increases in centimeters. So when you're 30, it's 30 centimeters. When you're 40, it's 40 centimeters. That's a rough guesstimate, but that's pretty accurate. And so the key point is that there's no extra space in your pelvis for a big prostate. But if your prostate grows out, then it's great. It just creates an obstacle. It can cause excess pressure on your bladder, which decreases your bladder capacity, which makes you urinate more frequently. And it also can push on the rectum and cause you to have constipation because you now have a semi-bowel obstruction situation. your urine tube, the urethra, goes straight through the middle of the prostate. If the prostate is swelling out, it can also swell in, and it can compromise the condition of the prostate. Kind of like if you have a straw and you squeeze it and you try to suck through it, then you're getting decreased flow. So you'll have decreased urinary flow, and that can cause some problems in your bladder, your kidneys, by causing urine retention. So benign prostatic hypertrophy means that your prostate is just getting big. Then there's benign prostatic hypertrophy with lower urinary tract symptoms, or LUTs. When that happens, then you're getting those urinary symptoms. You're retaining urine, you're urinating more frequently. You may get so much pressure that it causes a hydronephrosis, where your kidneys start to literally swell like a balloon, and they can't drain the way that they should. So you can have just benign prostatic hypertrophy with LUTs. And then if you get inflammation of the prostate, now you're predisposing your prostate to cancer, which it is very susceptible to. But BPH, or enlarged prostate, is not cancer. Those two things are separate. But if that prostate gets infected and you go from, you get a prostatitis, that is a curse, because it's very difficult to clear the prostate of infection, because one, is like a sponge. Two, blood flow down there is limited. So you take high doses of antibiotics to get a little bit of antibiotic down into the prostate. So you're going to have using GI side effects with the antibiotic therapy, because you have to take such high doses for such a long period of time. Most antibiotic therapy is 5, 7, 10 days. With the prostate, 30, sometimes more, sometimes 90 days of taking a very high dose of antibiotic. So it causes a lot of GI issues as well. So again, keep that prostate empty. Frequent ejaculation, that is the primary therapy. Great question. Next question. Nicole Green, I suffer from diverticulitis. Is there a natural remedy that I can take to coat my stomach? Okay, diverticulitis does not involve the stomach. Diverticulitis is a problem with the large intestines. And what it is like having an extra appendix or multiple extra appendices. And I'm seeing more and more of these cases diagnosed. It seems to be becoming prevalent. I don't know whether it's because we have low fiber diets now that makes it we strain on the toilet, or people are sitting on the toilet doing social media and not emptying their colon, or having to strain at a bowel movement. Every place that there's an artery that provides nourishment to the large intestines is a weak place in the wall of the intestines. The artery has to penetrate the wall of the intestines. That weak spot, when you sit down on the toilet and perform what's called the Valsalva maneuver, that's where you sit down and grunt. When you do that, you're creating a pressure that can literally go through that weak spot and create that finger-like projection, which is basically just like your appendix. And that means it's susceptible to infection like your appendix. You have an appendix, no problem. You get it infected, now you have appendicitis, which is a big problem, usually a medical emergency. When you have diverticulosis, that is the condition of diverticulum, then you just have the diverticulum. You just have to be careful. When you have diverticulitis, which is the term that you use, that means inflammation of an infection. That can be treated usually effectively with antibiotic therapy and then a high fiber diet, avoiding things like peanuts and watermelon seeds. You can't swallow them because they can get inside of a diverticulum, cause infection. So those are things that are limited from your diet, or any type of seed. You can't swallow seeds because they will go through your intestines undigested and get into the diverticulum and cause that problem. So a high fiber diet is your friend. I'd also recommend probiotics to keep the bacteria in your stomach, the good kind, because a diverticulitis is a medical problem that can result in surgery. A ruptured diverticulum, where just like a ruptured appendix, is a medical emergency and results in a life-threatening situation. So you have to make sure that you're following those things. So natural things you can do to keep it under control, not coat your stomach, but to help minimize the chance of you having a medical emergency, would be a high fiber diet. And we have a product, our Lipo Cleanse product, gives you a fiber, and it's not a laxative, but what it does is allow you to have large, easy to pass stools that will make your diverticulosis calm it down, so you don't have inflammation there and end up with diverticulitis. So go to the website, lipodrops.com, look at the Lipo Cleanse product, and that's one of the things that can help with that. Again, you probably will benefit from the probiotics as well. So lipobiotics would be good to add to that treatment regimen. But again, change in habits. Crunchy fruits and vegetables are a mainstay in your diet now, and things that are difficult to digest, thick steaks, red meat, are problems you want to avoid or minimize in your diet. And you cannot go and sit on the toilet for an hour reading the newspaper or doing your social media. So you want to get on the toilet, get off the toilet, so you're not putting pressure on those diverticular. Great question, Nicole. Okay. Ann Wells, Dr. Collier, my partner suffers from epilepsy. Will lipo drops help him with no side effects? He takes Keppra. Okay, lipo drops will help him lose weight and is compatible with the Keppra. Won't affect his seizure activity one way or the other. Epilepsy is seizures. Keppra is a very effective medication for doing that. He's on a good therapeutic dose. And vitamin B12 is addition. Particularly, I would take vitamin B12 sublingually, which means under the tongue. Oral vitamin B12 is not absorbed well in the stomach. So if it's a tablet or a capsule that you're supposed to swallow, don't take that. Just get rid of it. Get a sublingual dosing, either a tablet that melts under your tongue or a liquid vitamin B12 that you squirt under your tongue, and that will give you great benefits. So lipo drops will help with the weight loss, lose the muffin top with lipo drops, but no effect on the seizures. Great question, Ann. Anita Suber, what is creatinine? Okay, what can I do to get back down to normal range? Okay, creatinine is one of 3 kidney function tests. It determines how well and how efficiently your kidneys are filtering your blood and removing toxins and making urine. So there are 3. One is the creatinine, the other is the blood urea nitrogen, or BUN, and the third is the glomerular filtration rate. The most important one is the glomerular filtration rate. That number should be 60 or higher. The creatinine should be less than 1.2. Most people it's between 0.6 and 1.2. 6 and 12 are basically, but without the decimal point, but 0.6 and 1.2. Higher than that, it's the first indication that you're not drinking enough water. So the primary therapy, believe it or not, is just increasing your intake of pure water. Not juice, not sodas, not tea. Nothing replaces water. So you want to make sure that you can improve that number immediately by starting to drink 8 to 10 glasses of water per day. This is going to be what you do forever now as part of your lifetime regimen. Nothing replaces that. So if you say, well, I want to have a cup of coffee, I want to have a glass of tea, then you also get a glass of water. If you drink that primary beverage, tea, soda, whatever it is, you drink the glass of water. You finish the glass of water before you get a refill on the tea, the juice, the soda, whatever it is. And once you've done that, if you get a second glass, you get another glass of water. That's one of the simple and elegant ways to ensure that you're drinking enough water, but you don't have to drink anything. You can just be a person that all I drink is water when I'm drinking, except socially. When I'm drinking alcoholic beverages for fun, that's different. But when you're drinking, with your meals or whatever, your beverage of choice is water. And if you're drinking anything other than water ever, you also get a glass of water. You ask for a glass of water when you first sit down in a restaurant. You sit down and have your meals. She comes over, I take your drink order. Can you get a round of water for everybody sitting at the table, please? And don't order anything else until you have that water. Once you have it, then you ask for any other beverage that you like, any appetizers that you like, because if you order either of those things, you may not ever get the water. So make that a part of your culture, that water becomes something that you're concentrating on and becomes important to you. You start doing that and get your creatinine checked in a month, it will be improved and down. In 3 months, you will have gotten the benefit that you need. What are the things that cause an elevation in creatinine? It can cause kidney disease, uncontrolled high blood pressure, uncontrolled diabetes. So if you have either of those disease states, you're going to have to also keep those things under control. But chronic kidney disease, or CKD, disproportionately affects people of color, and it's the most underdiagnosed because you don't have symptoms until you do. Those symptoms are kidney failure and maybe even ultimately resulting in being on dialysis. But if you just got a slight elevation of creatinine now, there's a lot of reserve in your kidney function, and it's one of the few organs that can regenerate itself. Your liver is the other one. So if it's been insulted, and it has because the creatinine is up, you can help heal that kidney naturally. And that was your question. Okay, Anita, good luck with that. Cindy Hill, how do you get fungus off your toenails? Is there anything over the counter? Cindy, I hate to tell you, no, there's nothing over the counter. All these paint-on products that you see advertised, none of them fix toenail fungus. One, understand this. Once a nail is fungoid, it is fungoid. It does not, nothing you can put on it will magically convert that nail back to normal nail. The nail grows from the base here. Okay, right there at the bottom of your fingernail. And it grows, that's what's called the nail matrix. That's what nail is made, and it moves forward. So I'll see if I can give you a better view. Let's use a pen. Okay, so here it grows. So fingernail, toenail, same thing. So if all of this is fungoid nail, you go to the nail shop and to the podiatrist, they can grind that down with a grinding tool and then allow new nail to grow out. There are medications, pills that will set up an antifungal barrier that will give you an antifungal response from head to toe. So that means your scalp won't get fungoid, your mouth won't get fungoid, your skin won't get fungoid, any other place in your body. And then you will notice as it grows out, new nail, new nail, new nail. And then at one point it'll be maybe half and half with the fungal nail and the new nail. And eventually the new nail grows out and the fungus nail is totally grown out, it drops off, or you file it down or whatever. That process can take months, depending upon if your nails grow 1 millimeter a month, and you got 12 millimeters of fungoid nail, it's going to take a year. If your nails grow faster, and most people grow anywhere from 2 to 5 millimeters per month, then that's how long it would take. But for most people, it takes a minimum of 3 months. You can take the medicine for 6 weeks to 12 weeks and then stop. Once you've done that, the antifungal barrier is set up under your skin, and then it grows out. You don't have to keep taking the medicine, even though your nail may not be totally normal at that point. But that is really the only way to do that. The problem is people are so concerned about the cosmetic, they will get fake nails put on top of the fungoid nail. Now they're doing that on the toes as well. I didn't even know that. They're doing it on the toes and the fingers. And so, but that doesn't fix the problem. That just covers it up. So it's important that you have that treated. Most primary care doctors can take care of it. If not, you can go to a dermatologist or a podiatrist to take care of it. If it's a toenail, the podiatrist may need to do some things to grind that extra fungus nail off to make it easier for the new nail to grow out. But there are ways to do it. But it can be treated very effectively. The medications, there are 3 oral medications that will do it. They are all generic now, so relatively inexpensive, but nothing that you can buy at your local grocery store is going to do it. Nothing you can buy on the internet is going to do it. So you don't need to waste your money on those paint-on, spray-on products. They're just not going to help convert a fungal nail to a normal nail. Okay, great question. Patrick White. Doctor, when you're told take your medication 3 times a day, is it every 8 hours or every 4 after you get up in the morning? You usually try to spread it out roughly 8 hours. That's the case with the vast majority of medications. But if they just say 3 times a day, you may be able to alter those hours, because technically if you take it every 8 hours, that means you're supposed to take it while you're sleeping. Most people don't do that. So most people take 1 in the morning, 1 in the afternoon, and 1 before they go to bed. So nothing bad is going to happen if you're an hour early or 2 hours early at the most. When you're taking a medication that's supposed to, 3 times a day, doesn't exactly translate to every 8 hours, as you have so astutely figured out. But it's not every 4 hours. So it would be every 6 to 8 hours would be reasonable and would work with most people's schedules. So most people take, say, a pill every 8 hours before work, after work, and at bedtime, and that's close enough. If you take it, like I said, an hour early, an hour late, nothing bad is going to happen. You're not going to have any problems with it. So that makes the easy regimen. But doctors need to be clear when they're saying that. And oftentimes when I write a prescription, if I want you to take it every 8 hours, I will say every 8 hours. But there are other medications I say take 3 times per day, like metformin, which I use for diabetes. Say take 3 times a day with your meals, breakfast, lunch, and dinner, whenever those are. The 8 hours doesn't matter. It's just I want you to get 1 dose in whenever you eat. So it's important that you understand the therapeutic objective of what it is that you're taking. For other medications, like blood pressure medications, it may be more important to try to get them as close to 8 hours as possible. But again, you don't want to wake up in the middle of the night to take a pill. So roughly 8 hours, anywhere within a 6 to 10 hour window would probably work and be therapeutic for you. Okay, great question, Patrick. Tara White, high blood pressure. I take hydrochlorothiazide and low sodium. One is causing body aches and one is causing chronic cough. What is a better alternative? There are many alternatives. There are at least 15 different medications you can take for blood pressure. If you're having problems with losartan, and one of the problems that it can cause is a chronic cough, it's rare, but as I stated, if it happens to you, if it's 1 out of 1,000,000 times and it happens to you, it's 100%. So it doesn't matter what I say, it shouldn't do it if it's doing it, because it can do it. Hydrochlorothiazide causing body aches means the dose may be too high, and that you may it may be lowering your potassium, and you may need potassium replacement. So you need to get your electrolytes checked. That is a blood test that you have to get at the doctor's office. Most doctors use hydrochlorothiazide at 25 milligram dose. You don't have to do that to get the benefit. I have found that if I first start seeing a person with high blood pressure, I will give them hydrochlorothiazide at 25 milligrams. And then 30 days later, after their blood pressure is down, I will lower that dose to 12.5 milligrams, because you get all the benefit of the hydrochlorothiazide at 12.5 without the risk of lowering your potassium like you will at 25 milligrams. Indubitably, they used to give you 50 milligrams of hydrochlorothiazide. And hydrochlorothiazide is a water pill. It's a diuretic. It makes you urinate. So you urinate out extra fluid. So you have a pipe, your blood vessels that's this big, and you take the diuretic, the fluid removed, and so you have a pipe this big with less fluid, ergo less pressure. So that is the mechanism of action for a diuretic. But hydrochlorothiazide has some other function in what's called the renin, angiotensin, aldosterone system that go beyond just making you urinate, that benefit your blood pressure. So a 12.5 milligram dose is not going to make you urinate as much, but it's going to be as effective in lowering your blood pressure over time. So losartan, if that's causing you to cough, you might need to get out of that class of drugs totally. And so a calcium channel blocker of some sort, the most common popular one is amlodipine, is very effective, particularly in people of color. There are other alternatives as well. So you need to partner with your doctor, but you don't have to take a medication for blood pressure or any other disease state for that matter that has side effects that make you feel worse than the disease state. Blood pressure usually has no symptoms. So you're taking a medicine now to lower blood pressure, which wasn't bothering you, and now you feel horrible. You got body aches and you're coughing. So the better alternative is to take a medication that does effectively lower your blood pressure without causing those side effects. So partner with your doctor, tell them that you need to change the medications. Again, I think that the benefit from the hydrochlorothiazide will still be there at the lower dose, but that's also you could totally stop taking that as well, and just take one of the other classes of drugs that will lower and control your blood pressure. Okay, great question, Tara. Vicky Crawwell, what can I take for severe sciatica nerve pain? Ooh, Vicky, boy, if I could answer that question, I could retire. There are several. The best therapy for sciatic nerve pain, which is the nerve that goes down, starts in the small of your back, goes down the posterior portion of your leg, and it can give you pain in the lower back, it can give you pain in the back and the buttock and the hip, it can give you pain in the back and the buttock and the hip that goes down your leg to your knee or all the way to your feet. I had a patient today. She said it hurt on both sides, all the way from her back to the bottom of her feet. Classic sciatica symptoms. So the key thing is that the problem is inflammation of the nerves coming out of the back. So you want to take an anti-inflammatory. When you get inflammation, it hurts. That muscle hurts. It causes spasms. So a muscle relaxant will be very important as well. But then physical therapy, stretching it out. You need to know your friendly neighborhood chiropractor is probably the best practitioner for you to partner with in reference to sciatic pain. And you're going to have to go and work with them. You start off maybe going 3 times per week, and then you need to be on a maintenance program to keep your back from hurting, because sciatica can get worse over time, and you now, quote, have a bad back. And that is nothing worse in life than to walk around with that back pain from sciatica. So be careful. When you sit down, you're sitting on your sciatic nerve. So for men in particular, first thing I tell them to do is take that wallet out of their pocket, because they're sitting on a rock that's aggravating the sciatic nerve. Now, you obviously don't carry a wallet in your back pocket, but depending upon the nature of your buttock, if you got a small buttock, then you don't have enough fat back there to protect the sciatic nerve. You got a large buttock, that can create a problem as well. So range of motion exercises like Tai Chi or yoga, also very effective for the back pain. But a simple thing is just sit in a chair, feet flat on the ground, shoulder width apart. Reach down and touch the floor with your hands. Go straight down. Don't twist like this. Go straight down. Hold your fingertips on the floor for a count of 10, then come straight back up. Relax. Do like 10 reps of that. That pulls the back forward, stretches the spine, and relaxes that sciatic, the pressure on the sciatic nerve, so you'll get relief from that. And while you're sitting there on the sofa watching television or whatever, do those exercises, stretch yourself out. And understand too, sometimes a piece of furniture, your favorite chair, your favorite sofa, your whatever piece of furniture you have in your she shed may be creating a problem. You might need to get some more ergonomic, particularly a chair that if you're working at a desk, you need an ergonomic chair that does not put pressure on that sciatic nerve. Good cushioning on the bottom. Great question, Vicky. All right. Jackie Duncan, is surgery the only option for dealing with gallstones? If you're not having pain, no. A lot of people live with gallstones all their life with no problems. The problem is if you eat a fatty meal, you eat 2 slices of pizza and you have gallstones, you're going to have a gallstone attack. So fatty foods, ice cream, cheese, those sorts of things. What the gallbladder does, it holds bile. There's a reservoir for bile that's like a bulb, like a perfume bulb or an atomizer. It's full of bile. When you eat something fatty, your stomach sends a signal to the gallbladder. The gallbladder squeezes and squirts that bile into the stomach. So that bile, the green stuff that you vomit when you get really sick, that's what bile is. And that's why it tastes bad. It tastes so acidic, because it is very caustic. It dissolves fat, and it's not supposed to be in any other part of your intestines. It causes that, and it helps dissolve the fat. If it's squeezing and that gallstone is blocking and causing an obstruction, when it squeezes, it's squeezing against a closed space. That is why it hurts, because it's squeezing against spasm. Now, you can have one big gallstone, which is actually pretty good, because that gives you a ball valve effect. You can just change your position and relieve that obstruction. If you got small gallstones or a tiny gallstone that's kind of about the size of a grain of rice that gets stuck inside the tube leading to the gallbladder, then that's what's called a gallstone ileus, and that has to be surgically removed. It's not going to come out spontaneously. You're not going to pass it most of the time, but they can go in or with a long scope and kind of put a basket around it and scoop it out. But if your that obstruction to your gallbladder causes that excess bile, which is made by your liver, to literally start to eat away at the gallbladder, then you go from cholecystitis. Now you have cholecystitis, which is inflammation of the gallbladder, just like appendicitis or diverticulitis. Itis means inflammation of. Now you have a medical condition that may require surgery. Just having gallstones is cholecystosis, condition of, and you can live with the stones oftentimes with no problem. Just have to modify your diet. So you can't go to the all-you-can-eat buffet and eat a lot of fatty foods and a lot of fatty desserts and not expect your gallbladder to act up. So, but if you go on a low-fat diet, the gallbladder, if it's not obstructing, will probably not bother you. You say no pain now, that means it's salvageable, because if it was bad, it would be hurting nonstop. So with no pain now, that means you're in a situation where you can fix that. So no problem, you can keep monitoring, but it's going to require a strict adherence to that diet. You can't say, well, I'm cheating this time, I'm going to have that cheesecake, because it'll come back to haunt you. Great question. Final question. Okay, Kylie Nelson. Okay, I was taking the Now Iron supplement, and then I switched to the Now Iron complex and started having headaches. With magnesium and iron supplements, do you suggest? Again, those products are fixed chemical formulas. You just need one that you can tolerate. You get a complete multiple vitamin with iron and minerals, and that can be one a day for women. It could be Centrum. It could be Z-Bec. A variety of them. See which one your body will tolerate. Iron can constipate you, and that's a problem, but the magnesium are very good supplements as well. The Lipo Night has magnesium in it, so that would be a great addition to what we're doing. I'm trying to get the ball up here for you to see it. Great addition to, there you go. The Lipo Night has magnesium in it. So one of the great things you can do in reference to your magnesium supplementation. So great evening tonight. This brings to an end this episode of the Ask Dr. MJ. I hope we answered your healthcare questions. I hope you got a lot of good information out, that you found this program both informative and entertaining. We are now live, and we will see you next time. So go to the website, lipodrops.com. The new Lipo Nights is 25% off. The Lipo T 3-pack is 31% off. And the Keto Mac capsules are now finally back in stock, one of our most popular weight loss supplements. And the Immunopack, now that we have this outbreak of the COVID, you need to protect yourself. So a combination of our Doctor's D, vitamin D3 at 5,000 international units per day, and the Immunopack will optimize your immune function and give you your best opportunities to avoid getting sick during this upcoming flu and COVID season. Thank you for a great night. We appreciate you. Thank you, Heimlich, for all you do to make this process look good and make me look good. And remember, this is archived. You can find it on YouTube, and we'll see you next time. Thank you.